Come in.
All right. Hi.
Hi, how are you?
Good. So my name is Natasha. I'm actually a student family nurse practitioner, and I'm coming in to do your health assessment.
Okay, cool.
Alrighty. So, do I have your consent to go ahead and post this video online so my instructor can see?
You do.
Okay. Alrighty.
Go ahead, nod.
Oh, okay.
COVID.
Alrighty. No problem at all. Alrighty. So could you please tell me your first and last name?
It's Taylor Jones.
Taylor Jones. And how would you like to be addressed?
Miss Jones is fine.
Miss Jones is fine. Alrighty. Thank you. Alrighty. So what's your date of birth?
06/29/1993.
And what's your current age?
I'm 27 years old.
Okay. And what's your race?
Of African American.
African American. And what do you currently identify as?
Female.
Okay. Alrighty. Thank you. All right, Miss Jones. So why are you here today?
I'm here for a wellness exam.
A wellness exam. Okay, great. So when was your last wellness exam?
About a year ago.
Okay, about a year ago.
Yeah.
Awesome. And have you had any mammograms done?
Yes.
Okay, so when was your last mammogram?
About a year ago as well.
About a year ago. Is it a reason why you had your mammogram? You're pretty young.
Yeah, so basically, breast cancer kind of runs on my dad's side of the family. They go ahead and, they do it, just to be, precaution, just so they can catch it early if I was diagnosed with that.
Okay. Alrighty. And when was your last pap smear?
Pap smear last year as well.
Last year as well.
And everything was normal with that and the mammogram.
Oh, okay. Alrighty. Thank you for that information. Okay, so I'm going to go ahead and ask you a few questions. Okay, so do you have any past medical history, such as diabetes, asthma, hypertension, high cholesterol?
No, I don't.
Nothing at all. Any past surgeries?
Yes, I had appendicitis, so I went ahead and got my appendix removed probably about 5 years ago.
5 years ago. So you would say 2015?
Yes, 2015.
What about the month? Do you remember the month?
It was close to my mom's birthday, so it was in October.
Okay, October 2015. Any other hospitalizations?
No.
No, okay. Thank you. Okay, and what about vaccinations or immunizations? Are you currently up to date with your measles, mumps, rubella, hepatitis?
Yes, currently I am. The only thing I haven't received is the flu shot this year.
The flu shot. Okay.
But I do plan on getting it.
You do? Okay. Did you have the flu vaccination last year also?
Yes, I did.
Yes, okay. So we can go ahead and get that done today.
Okay.
Alrighty. Any allergies to like food or drugs, environmental?
I'm allergic to iodine.
Iodine. Okay. So what happens when you come in contact with iodine?
I get really, really, really hot, and I kind of flushing, and I get itchy.
Itchy. Okay. Is that usually okay? No problem. So is it like a rash?
I think so. Yeah.
More like a rash.
More like a rash.
Can you describe the rash? Is it like red, like little bumps?
Yeah, it's red bumps, and I be really, really hot.
Okay. Is it all over, or like in a particular spot?
It's whenever they injected it at.
Okay.
Normally in that area.
Alrighty. Okay. And do you take any current medications, like prescription?
No.
No. Okay. What about any over-the-counter medications like Advil, Tylenol?
Well,
anything?
I do take prescription. I take that back. I'm on birth control.
Okay. Alrighty. And any over-the-counter medications?
I take Tylenol or Advil or for menstrual cramps.
Okay. And do you know the dosage of the Tylenol?
No, I don't remember.
Okay. And it's just only when you have the cramps?
Yeah.
Okay.
Every blue moon, because it barely works anyway.
Okay. Alrighty. Do you take any supplements? Any type of herbal products? Like St. John's wort or maybe the melatonin, anything?
See, I want to try those things, but I just know there's a lot of drug reactions and stuff to that, so I just stay away from it.
Okay. All right. Thank you. All right. So we're going to move on to your family history.
Okay.
So, is your mom still living? Your mom and your dad?
Yes, my mom is, my dad is deceased.
Your dad is deceased. Okay, so when did your dad pass away?
When I was 9, so I don't even remember the year.
Okay. Okay. Do you know his age when he?
32,
32?
I believe.
Okay. And do you know how he passed away?
No, I don't.
Okay. All right. And your mom's still living? Does your mom have any medical history? Diabetes, hypertension, high cholesterol, asthma? No? Okay. What about your dad that you know? I know you said you were 9 when he passed away. So do you have any idea of his medical history?
Not of his. I just know cancer runs on that side.
Okay. And do you know who had cancer?
His 2 sisters died from cancer.
Okay.
One had breast cancer and one had another cancer that I didn't know about.
Okay. Thank you. And what do you have any siblings?
Yes.
Okay.
3.
3? Okay. Do you have brothers, sisters?
2 brothers, 1 sister.
2 brothers, 1 sister. And do you know if any of those have like any type of medical history?
No.
No, neither one of them. Okay. Alrighty. And what about your grandmother, grandfather on your mom's side?
My maternal grandfather had cardiac issues, and he had diabetes, and I believe he had hypertension.
Okay. Diabetes, hypertension. Do you know what type of cardiac issues?
No, I don't recall.
Okay.
But I just know if he had a bad heart or something like.
Okay. Thank you. And that's on your mom's side, correct?
Yes.
What about your grandmother on your mom's side?
Granny, on my mom's side, she has high cholesterol, I think.
Okay.
And yeah, that's probably about it.
That's about it. And what about your grandparents on your dad's side, if you know? Do you know if they have any type of medical history?
I don't.
Okay. Alrighty. Thank you so much. And do you have any children?
No.
No. Okay. Thank you. Alrighty. Moving right along. So, do you currently use any type of tobacco or nicotine?
Socially.
Socially. So, what do you do socially?
Hookahs.
Okay. So, how often do you smoke a hookah? It's just like socially?
It's not even off. Like, probably, I want to say about 3 times, 4 times out the month, if that.
Okay. Alrighty. Any type of illicit drugs? Like, do you smoke marijuana? Any cocaine?
No.
No. Alrighty. And what about alcohol? Do you drink alcohol?
Socially, yeah.
Socially. And how often would you say? Just on an estimate.
Every blue moon. It's probably like every social event. If you in my family, we have one every weekend. So that's often, honestly. Probably like every Saturday. Probably about 3 or 4 Saturdays out the month. So that's every Saturday in the month.
Okay. So what type of alcohol do you drink when you're drinking socially? Is it like wine or is it like hard liquor?
It'd be mixed. I don't know what they put in there.
Both. Okay.
Yeah, so it'd be probably clear brown. I mean, like, it'd be a lot of stuff. And then, like, I drink wine on occasion.
Okay.
But I'm not an alcoholic.
Oh, no. Not at all. Okay. Yeah, these are just questions we have to ask everybody.
Okay.
Alrighty. So, what about your current... do you exercise?
Yes.
Okay, great. So, how often?
I've been slacking. So probably once a month.
Once a month? And what kind of exercise do you do? Are you just like walking or are you doing like...
I run. I do jumping rope. I do some cardio. I do the Stairmaster. Cause I got a gym membership, so I try to stay fit, whenever
that's really
good.
Awesome. Okay. And what's your current diet like? Is it just a general diet? Are you a vegetarian? Do you cut anything out of your diet or you just kind of eat?
No, I eat whatever I want.
Whatever you want. Alrighty.
Which isn't good, but
I don't know. It's fine. So what about, do you eat is it mostly fast food or home cooked meals?
Home cooked meals.
Home cooked meals. So do you eat any fast food at all?
Yes.
Oh, do you know how often?
Probably about 3 times a week.
3 times a week. Okay. Thank you. Oh, do you drink any caffeine?
No.
Nope. No soda?
Occasionally.
Coffee? Okay.
That's like every once per month, the soda.
Okay. Alrighty. Thank you. Alrighty. So, when was your last menstrual period?
Today is my last day. So,
so you're currently on.
I'm currently on it, and probably like last week it started. Probably what today is Sunday. It probably started probably Monday.
Okay. And how long does your
Normally last 7 days.
7 days.
Yeah.
Okay. Is it like a heavy flow or is it just like regular? How would you describe your flow?
Heavy the first 3 days. Yeah, regular the last 4.
Okay. All right. Are you currently sexually active?
Yes.
Yes. Okay. Do you have multiple partners? Are you in a relationship?
I'm in a relationship.
Okay. So just one partner?
Just one partner.
All right. Alrighty. So, any past pregnancies?
No.
Have you ever been pregnant? No. And you currently don't have any kids? No. Alrighty. And no abortions? Okay.
No.
Awesome. Okay. And have you had any STIs that you know of?
No.
No. Okay. Alrighty. Thank you. Okay. So what do you currently do for work?
I'm a nurse.
Okay. Awesome. How long have you been a nurse?
First year.
Oh, wow. Congratulations.
Thank you.
Are you enjoying it so far?
Is that rhetorical?
Oh, goodness. It's definitely
difficult right now, huh?
Oh, yeah, especially with COVID and everything. Alrighty. Let's see. And where do you currently live?
I stay at my mom's house.
Okay. And it's just you and your mom?
My mom, her husband, me, my brother, and my sister.
Okay. Alrighty. So any religious affiliations that you have?
I'm a Christian. That's the only thing I can say. I'm a Christian.
Alright. And do you go to church? Do you have pretty much a pretty good social support?
Yeah, kinda. My friends, we all kinda do these small little group meetings. If we can't make it to church on Sunday because our work schedules prevent us from going to church, so we'll do like small groups, or we'll do just daily devotions.
Okay. Alrighty. Awesome. Okay. So safety. Do you drive a vehicle, or how do you get around?
I have my own vehicle.
You have your own vehicle. All right. And do you wear a seatbelt?
Yes, I do.
Yes. Do you text and drive?
No.
Any drinking and driving? No. Okay. All right. And at home, do you own any guns? Yep. Okay. Do you keep it locked away, like in a safe?
I'm licensed to carry, so I keep it in my car.
You keep it in your car. Okay. All right. Any history of domestic violence or?
No.
No. Alrighty, thank you. And you currently get around perfectly fine by yourself? Like you don't use a cane, a walker, a wheelchair?
No.
Okay. And you're currently able to dress yourself, feed yourself? Pretty independent. Alrighty. Okay. So next we're just gonna go over a review of your systems.
Okay.
Just gonna ask you a couple questions, alrighty?
Okay.
Then we'll be almost done. Okay. Do you have any issues with your eyes?
I wear glasses.
You wear glasses? Okay. What about your ears, nose, or throat? Any problems?
My nose is partially blocked. One of my nostrils. It's difficult for me to breathe out of it sometimes. But other than that, my eyes, my throat, everything is okay.
Okay. Do you use anything for your nose?
No, I wanted to see a doctor about that because I was trying to figure out why. But other than that, no. I mean, I can breathe out of it. It's just, I don't know.
It could be just seasonal. Do you have any allergies?
I don't. That's why
No?
it's weird.
Okay, no environmental allergies. Okay. Alrighty, I'll make sure I let the doctor know.
Okay.
Alrighty. Any cardiovascular issues? Any heart issues that you know of?
No.
No. What about any respiratory issues? Any problems with breathing? No. No asthma, right?
No.
No. Okay. Any issues with your stomach? No.
No.
Okay. So how often do you have a bowel movement? Is it on a daily or every other day?
Probably every other day. I wouldn't say daily. I'm trying to eat more fiber to regulate that, but right now it's every other day.
Every other day. And that's your usual?
Yeah, that's my usual.
Okay. And no constipation or anything? No diarrhea?
Depending on what I eat.
Okay.
So I be constipated depending on if I eat like different foods. But other than that, it comes out regularly.
Okay. And are you urinating okay? You need pain?
No.
Okay.
It's fine, just fine.
No foul smells?
No.
Okay. And what about your muscles? Do you feel like your extremities are pretty equal and pretty strong?
Well, my knee. But, I mean, I dislocated my knee probably, I forgot to tell you that. I dislocated my knee probably about 7 years ago.
Okay.
And so, like,
did you have to go to the hospital for that, or?
Yes, I did.
Okay.
And they actually gave me a knee brace
Mm-hmm.
and everything. And I had to go. I went to physical therapy for a couple of days.
Oh, wow. You said this was seven years ago?
Probably, if not 7, about 5, 6.
5 or 6. Okay. So do you know the year?
I don't.
No. Okay.
I don't remember.
Alrighty. That's fine. Any issues with your skin?
I have acne really bad, you know. It comes here and there.
Mm-hmm. Do you take anything?
I was on Accutane probably about 2 years ago, but not right now.
Not right now?
It's not nearly as bad as it used to be.
Okay.
It's really systematic when I start my cycle.
Mm-hmm.
Yeah,
Okay.
I'll have, breakout here and there.
Alright. Thank you. Any issues with your breast?
No.
Nope. None at all. Any neurological issues
No.
you can think of? Any psychiatric history or issues that depression, anxiety?
Well, I battle with anxiety. I have really bad social anxiety and test anxiety.
Mm-hmm.
So
But you don't take any medication?
I don't take any
of those?
medications for it.
Okay. So what do you do? Do you have like any coping mechanisms?
I don't. Do you have any that you want to recommend to me?
Oh yeah, we can definitely discuss that.
Okay.
Alrighty. Any issues like with your lymph nodes? Are they like swollen? Any pain?
No.
Okay. Do you know if you have like any issues with your blood? Any like anemia that you may know of?
I do have anemia.
You
I'm
do have
anemic.
Okay, you're anemic.
Yeah.
Mm-hmm. Do you take like iron supplements or anything?
Mm-mm.
No.
It makes me constipated,
Okay.
so I don't take them.
All right. Are they so okay? But nothing was prescribed to you correctly,
They did.
and you just don't take them.
Mm-mm.
Okay. I mean, we can go ahead and look at that because we can like put you on like a stool regimen.
Oh, okay.
Yeah. for
Bowel
stool
training or
softeners.
something.
Yeah.
Okay.
Alrighty. And endocrine, any issues there?
No.
Like diabetes, nothing with your blood sugar?
Mm-mm.
Okay. And you don't have any, okay, and your only allergy is to iodine.
Right. Correct.
Okay. Alrighty. So that pretty much completes my health assessment for you.
Okay.
Alrighty. I'm just going to do a couple of risk assessments. Do you have any questions for me right now?
I don't.
Okay. Alrighty. Well, thank you so much for allowing me to interview you. It was very nice meeting you.
Okay. Give me some elbow.
Alrighty. Okay. Well, you have a good day.
You
I'll
too.
come back in a little bit.
Okay. Bye-bye.
Alright. Bye-bye.